Hi, everyone. Thank you so much for joining us today. My name is Sydney, and I am with 5.13 Workshops, and our topic today is Medicare. We have some wonderful presenters with us today that are going to take you through this journey and really dive in and educate you on this wonderful topic. But before I turn it over to them and get started, I want to go through a couple of housekeeping items with you just to make your experience here more dedicated to you. So on the very bottom of your screen, you're going to see a Q&A. Go ahead and click on that and type in any questions or comments you have throughout our webinar today. Stacy and Mike are going to have a little Q&A session at the very end of the webinar after their presentation. So again, if you have any questions, just pop them in there and we will get to them at the very end. Now, the next thing, you are going to see a button that says chat. Again, at the very bottom of your screen, I will be putting Kevin Ward's contact information along with Stacy and Mike's contact information. So if you have any additional questions for them, their website and their email and their phone number are in there. And I will post that in there continuously so you can grab it whenever you'd like. So without further ado, I am going to turn it over to our presenters today, and Kevin Ward is going to kick us off.
Good morning. My name is Kevin Ward, and thank you for being with us today for this educational webinar. I work for Bloomfield Investment Group. We're an advisory firm that creates holistic financial plans. And what I mean by that is that we review your overall financial picture, which includes not only investments, money, but also big decisions that will prepare you for unexpected circumstances or affect your way of life, such as Medicare, Social Security, estate planning. We've been in this office since 1985, and over the years, we have partnered up with many great resources at Bloomfield Investment Group. And I feel it's very important to share materials from these resources as we are doing today, so our clients can make the most educated choices on topics such as Medicare. Today, we are going to host an educational webinar with one of our resources and experts in Medicare. I would like to introduce Mike and Stacy Gallagher at Physicians Mutual, who are experts in Medicare, and they can help you make an educated decision on which Medicare benefit is best for you. Mike and Stacy.
Okay. Good morning, and thank you very much, Kevin. We appreciate the introduction, and we are thrilled to be here. We also want to thank our friends here at Bloomfield Financial for including us in this opportunity this morning. And all of you that are in attendance, we certainly appreciate you as well. It's very encouraging to see so many people interested in wanting to learn about Medicare and taking that interest in the time to do so. Now, whether you've done much research or had discussions or met with professionals or did a lot of reading on your own, no matter what amount that you've done at this point, we're probably pretty sure that you're recognizing there is a lot to learn about Medicare and all of the different associated choices that come along with that. There's lots and lots of different options for people to consider, probably a lot more than people actually realize. So again, we applaud your efforts for taking the time to learn along with us today. We hear a lot, Mike and I do hear a lot from people that the whole concept of Medicare just feels a little daunting, overwhelming. It appears complicated and confusing. And sometimes it can be. But that's why people like Mike and I are around. So what our goal is this morning is that we're planning to systematically walk through this Medicare maze with all of you to hopefully enhance your understanding of all that Medicare has to offer. You're also going to likely notice an underlying message here between us, and that's that there is a no one size fits all. These are very important decisions that each of you, as you are embarking upon those months where you're becoming eligible and are considering enrolling in Medicare, there's lots of different things to consider. So I'm sure if you haven't already, but most of us all know very well-meaning family friends, neighbors, coworkers, and so on that are very excited to share their experience and their education and their opinions about all the different choices that are available to you. And while that's all well and good, and we certainly don't discourage you from having those conversations, we're just going to remind you that everybody's circumstances, their goals, their preferences, that of their families, all those are very unique. So the choices that you're going to make in this arena, you really want to be aligned with those of yours and your families. The other thing is that things may change, you know, from the time that some of your friends or family members have signed up for Medicare itself, or some of the other options that are available to augment the benefits of Medicare. Sometimes regulations have changed, options have changed, and new things come on the horizon too. There are new options each and every year that other plans may have changed, or different carriers have added different benefits to enhance what was available before. So you don't want to miss the opportunity to know what all of the options are in front of you when you're making these decisions. And one thing too that we want to just make at a point here at the beginning before we get started is that you might hear often that, well, if you don't like the choice that you've made, you can always change it. Well, that's not always necessarily true. Hopefully, people's health remains very positive and very good for a very long period of time. If that's the case, then you're probably very likely going to make a change to something that you may have enrolled in to augment your Medicare choices. But if that's not the case, then oftentimes you're not necessarily going to have many options to change that original decision. So Mike and I like to tell people the best that you can, to the very best of your ability, when you're doing your research, when you're making these decisions, think about them as a lifelong decision and something that you're aiming to be comfortable with the thought that it might be a lifelong decision for you. So having said all of that, I'm going to go ahead and let Mike get started now on all the different aspects.
Thank you, Kevin and Stacy, and we appreciate everyone's time this morning. One of the companies that we represent is Physicians Mutual and Physicians Life. That organization, if you're unfamiliar with it, has been around for 119 years. They are headquartered in Omaha, Nebraska, and they've been in the Medicare space for over 50 years. They're a mutual company, which means they're owned by their policy owners and not stockholders. And there are independent organizations that rank insurance companies based on their financial strength and stability. Both AM Best and Weiss are two such organizations, and they have given Physicians Life and Physicians Mutual the highest of ratings for many, many years. So what we're going to talk about today is transitioning from being an employee to a retiree, how you access your healthcare coverage, how does one enroll in Medicare, and when one should enroll in Medicare, what are the different components of Medicare, parts A, B, C, and D, and how am I going to pay for my health-related expenses when I am retired and covered by Medicare? First off, let's discuss Medicare. Medicare is a federal program that began in 1965, and it's predominantly health insurance for seniors, predominantly people that are age 65 and older. However, individuals may qualify for Medicare prior to age 65 if they have certain medical or disabling conditions. I often find that many people confuse Medicare with Medicaid. Medicaid is a combined state and federal program that is designed to provide health insurance for those people with limited financial resources. And there's certain qualification requirements associated with that. Our focus today is on Medicare. So the basics of Medicare, again, as I mentioned, it was established in 1965 by the Centers for Medicare and Medicaid Services. It is for seniors, And Medicare has been updated in recent years. The Medicare Modernization Act was established to create Medicare Part C, also known as Medicare Advantage plans. And they've also added another component to Medicare, Medicare Part D, which is prescription drug. Some of you may have received from CMS a Medicare and You guidebook. I recommend it as a very good resource describing all aspects of Medicare. And there's also another publication from CMS, which is Choosing a Medigap Policy, also known as a Medicare Supplement. If you haven't obtained one of these copies, let us know. We certainly can email you a Medigap policy booklet so that you can understand all the components of a Medigap plan.
So what we have here on this slide are some very common questions and concerns that we hear from individuals as they are embarking upon their research into initiating their Medicare benefits. And so we're going to go into a lot of these in a much more detail, but just on a high level view, when people become eligible for Medicare, most of the time, not always, but most of the time, it's when they reach the age of 65. You have opportunities to enroll in Medicare at that time during what's called your initial enrollment period. That's going to be 3 months before your birthday month, the month of your 65th birthday, and 3 months thereafter. There are also other enrollment periods, and Mike's going to go through those in great detail so that you're all very aware of when the different options are that you have to become enrolled in Medicare. The other thing we hear a lot about is people tend to think that Medicare and Social Security are one and the same in terms of when one's benefits start to commence. They are actually two different programs. They each have their own regulations, their own enrollment processes. So while somebody may choose to start their Medicare benefits at the same time that they are applying for their Social Security benefits, that's not always required at all. These can be done at two completely different times. So sometimes people are going to retire earlier than when they turn 65. That's obviously an option for people. You're just going to want to explore what options that you might have available to you to cover your healthcare costs, your healthcare coverages before you actually retire from whatever occupation that you are currently in. Now, maybe COBRA might be an option for you. If your spouse is working, maybe they have an employer-sponsored health plan that you can join. There are many carriers, insurance carriers on the market that have short-term medical plans, and that's exactly what they are. They are plans that are designed for people who are looking for some degree of coverage and healthcare protection in a temporary basis. So prior to becoming eligible for Medicare, as an example. The other thing is that today, it's not uncommon whatsoever to have people choosing to keep their careers or their current jobs until after the age of 65, maybe well beyond the age of 65. So there are options too for you to remain. If you have an employer-sponsored healthcare plan, you can stay enrolled in that and enroll in Medicare at a different time. And that's another thing when we talk about enrollment periods that Mike will cover for us in a little bit greater detail. So let's say somebody turns 65 and they are ready to retire and switch over to Medicare, but their spouse is not eligible yet. Then the options would be similar to you retiring early. Maybe your spouse, their own employer, if they are employed, has a sponsored healthcare benefit available through their employer. Or again, there are carriers that offer many different types of levels of coverage that can be purchased for a short-term basis. Social Security, what's here, again, as Mike mentioned, we're not going to really do a deep dive onto Social Security, but here's some information so that you're aware of what types of information you are going to have available when you are ready to enroll and request receiving your Social Security benefits. That's a whole nother conversation in and of itself. And similar to your Medicare choices, we'd encourage you to make sure that you get all your facts from a professional, because there are a variety of different decisions that are going to affect your future, that you, again, are going to want to make that decision when to activate your Social Security benefits based on the circumstances that are unique to you at that particular time. If you do, when you do decide to enroll, you have 3 options. You can do that online, you can do it on the phone, or you can apply in person. You can schedule an appointment for a phone appointment to get your registration taken care of, as well as in person. So we actually advise you, especially these days, to make sure that you have an appointment with a Social Security advisor, whether you want to do that on the phone or in person.
Okay, let's talk about when one should enroll in Medicare. If you or your spouse is employed and you receive credible group health coverage through your employer, you are not required to enroll in Medicare at age 65. You can defer that enrollment. However, when you and your spouse do retire and you are over 65, there's going to be what's called a special enrollment period, which I'll describe in a bit. And the other strategy that you need to take into account is, do I have other dependents in my family that I am providing health insurance for through my employment? And if that's the case, certainly one needs to take into account what are the ages of their spouse in terms of he or she being 65, and if there are other dependent children that one may be covering. It may require one to defer their retirement so that they can retain coverage through their employer in a means to cover their spouse. So let's first talk about Medicare Part A, which is inpatient hospitalization. If one is claiming Social Security retirement benefits at the time they turn 65, Social Security will automatically enroll you in Medicare Part A. For most individuals, Part A of Medicare is going to be 0 premium. That is going to apply to individuals who have worked at least 40 quarters or 10 years and contributed into Social Security tax or FICA. There may be situations where you don't have enough work credits to qualify for Part A premium free. You may be able to qualify through your spouse if he or she has completed at least 10 years of working credits. For some people, if they do not enroll in Part A when they're first eligible, they could be subject to a 10% penalty increase, and that is something you want to discuss that with the representatives from Social Security. I will mention, and I'll go into detail on this, that there are going to be deductibles and co-payments associated with Medicare Part A, which is the inpatient hospitalization. If you are not claiming Social Security retirement benefits, one will need to enroll in Medicare Part A and take the initiative for that. And Stacy referenced that in the prior slide, where you can do that online or schedule a phone appointment or schedule an in-person appointment. So signing up for Part A, and this is also going to apply to Medicare Part B, outpatient medical surgical, but there's 3 key enrollment periods that one needs to be aware of. There's what Medicare refers to as their initial enrollment period, IEP for short. This is that 7-month window that begins 3 months prior to the month one turns age 65. It includes the month that they turn 65 and 3 months beyond, where you may enroll in Medicare Parts A as well as Part B and not be subject to any late enrollment penalty. I should also mention that if your date of birth happens to fall on the 1st of the month, you are actually eligible for Medicare Parts A and B 1 month prior to the month that you turn 65. There's also what is known as a special enrollment period. For those of you who are planning to work beyond age 65 and have access to health insurance coverage through your employment, you can defer your enrollment in Medicare Parts A and B. You will not be subject to a late enrollment penalty if you are in this special enrollment period. When the special enrollment period ends, where you potentially could be subject to a late enrollment penalty, is if after you retire or you lose your group health insurance coverage, you must enroll in Medicare Parts A and B within 8 months of retirement or losing that coverage. Otherwise, one would be subject to a late enrollment penalty. Finally, there's a general enrollment period. For those individuals who elect not to enroll in Medicare A and B during their initial enrollment period or special enrollment period, they have the opportunity to enroll in what is known as the general enrollment period. And this is from January 1 to March 31st of every calendar year. If you elect to enroll in Medicare during this time frame, your coverage for Medicare will then be effective July 1st of that calendar year. However, bear in mind, one could be subject to a late enrollment penalty if they enroll during their general enrollment period. So let's talk about Medicare Part B. If you are collecting Social Security benefits, as I had mentioned earlier, Social Security retirement benefits, Medicare is going to automatically enroll you in Medicare Part B. And that is going to start on the first day of the month you turn 65. You also have the opportunity to enroll in a Medigap, also known as a Medicare supplement plan. These programs are designed to pick up the expenses not covered by Medicare Parts A and B, and you can do this during your initial enrollment period as well as special enrollment period. If you elect not to enroll in Medicare Part B, there'll be instructions when you receive your Medicare ID card that you can turn that in back to Social Security, and you can delay or defer your enrollment in Medicare Part B if you so choose. So let's talk a little bit more about signing up for Part B. If you did not elect to enroll in Part B when you first became eligible, the other opportunity times include the special enrollment period and general enrollment period, which I just described. If you are older than age 65 and sign up for Part B, I referenced the Medigap or Medicare supplement opportunity that you have to enroll in. There is what's known as a guaranteed issue right. This means that if you elect to enroll in a Medigap plan, either during your initial enrollment period or special enrollment period, you have that ability where you can enroll in that, and the insurance company must accept your application, also known as a guaranteed issue right. And that guaranteed acceptance is immaterial to one's health status, whether it's good or bad. The insurance company must accept your application to a Medigap plan during the initial or special enrollment period. Unlike Medicare Part A, which is zero premium for most people, one will pay a premium for Medicare Part B. And you can see on this chart that the premium Medicare is going to charge you for Part B is going to be based on one's filed income. You can see from the chart that Medicare Part B premium is going to start at $148.50 for those individuals who have a tax filed income on an individual basis of $88,000 or less, or if you filed jointly, $176,000 or less. Key thing that you should understand, when you go to apply for Medicare Part B, they're going to look at your modified adjusted gross income, which is typically line 11 on your tax filing. They're going to look at that income for the 2 years prior. So for those of you who are nearing 65, keep in mind that they're going to look at your filed income when you were 63 and you filed during that calendar year. So they're going to do a 2-year look back. You can see if you are a higher wage earner, Medicare is going to charge a greater premium for Part B, and it can be as high as $504.90 a month for the highest of wage earners. Another key thing to keep in mind is that if you start out as a higher wage earner and during your retirement years, your income declines, Medicare is going to adjust your premium to reflect the income that you are at. So those are important strategies that you want to discuss with Kevin or whoever your advisor is so that you can plan accordingly and anticipate what that Medicare Part B premium is going to be. One other point that I want to make with Medicare Part B is that if you claim Social Security retirement benefits, Medicare is going to deduct the premium for Part B from your monthly Social Security retirement check. If you are not claiming Social Security retirement benefits, then Medicare will invoice you quarterly in advance for your Part B premium.
Okay, thank you, Michael. So now that we've done a high-level review of what Medicare is, the different enrollment periods and those processes, and the associated premiums, we're going to do the same thing now with the different parts of Medicare. So I'm going to give you a high-level overview of what all of these different parts of Medicare, what they cover, what's encompassed in those different pieces, and then we'll follow it up with a much deeper dive on some other details as well. So you're going to see that Medicare, while it does pay for many, many healthcare services and supplies, it's certainly not going to cover all of the healthcare costs that one may incur during their coverage with Medicare. There's going to be things like costs associated with coinsurance, co-payments, and deductibles. So as we take a look at each of these, keep in mind too that the amounts are going to change each year. So the coinsurance, the co-pays, the deductibles, and things like that, they will be different each and every year. So Medicare Parts A and B together are considered original Medicare. So whenever you read that or hear that term, that's what it's referring to, are the two parts A and B together is what's known as original Medicare. Now, Part A is your hospital insurance. That's going to provide cost coverages and benefits that are related while you are an inpatient in a hospital, skilled nursing care, hospice, certain types of medically necessary home health care once you leave hospital. And as Michael mentioned before, most people are not going to pay a premium for Part A benefits. One way to think about Part A as the hospital insurance is it's going to be the portion of your Medicare policy that addresses inpatient type related care. Whereas Part B, that's going to be the part of Medicare that's going to cover things that are more of an outpatient based type of care, such as your doctor services. When you go to your doctor on an outpatient basis, you have different types of therapy, some types of home health care. Also, some durable medical equipment is going to be covered under Part B. Part B also covers preventive services. We're going to go over that in quite a bit of detail in just a little bit as well. And as Mike's already covered, enrollment is considered optional. There is a premium that you'll have to pay that's based on your income on Part B. And then Part C, that is an alternative to original Medicare. It's most commonly referred to as a Medicare Advantage plan or an MA plan. The most common types of those that are going to be available to you are things that you're probably familiar with. They're going to be an HMO type model or a PPO type model. This type of coverage is they combine. They're offered by independent insurance companies, and it's going to combine the required services that you would otherwise receive in Medicare Parts A and B. They're going to vary across different companies, the offerings of them. So the cost for those services and items will be different across the different plans. The one thing when you do your research that you're going to want to keep in mind as you investigate the Medicare Advantage plans, one of the key differentiators about them is you're going to want to know what your potential out-of-pocket costs are, as well as network restrictions. We'll touch on that in a little bit more detail as well, but those are two things that you're going to want to pay attention to as you do your research and have your meetings and discussions with professionals. Now, Part D, that's your prescription drug coverage. Now, that people's health status does not matter with this. These are open to anyone that is eligible to enroll in Parts A and B of Medicare. You do have to have Part B. And these are offered by independent insurance companies, and they will vary state to state. And we'll talk about those as they apply in Colorado just a little bit on down the road here.
So let's look at the full spectrum of the related healthcare needs that one may need. And you can see from this chart that one needs to be planning for both acute and chronic care needs. And I also refer to extended care needs. These are services that we're going to need during our lifetime. And so we want to develop a strategy that creates a very solid longevity health plan. And let's understand what components Medicare fills in on this pie chart. First, let's look at inpatient hospitalization, which is part of Medicare Part A. With Medicare Part A is going to cover the first 60 days of inpatient hospitalization in full. However, Part A does have a deductible, and that deductible is currently $484. Now, you'll see that Medicare defines this deductible as a benefit period deductible. What that means to you is this: if you are admitted as an inpatient for 3 days and then discharged, you would be responsible for the first $1,484 of expenses. Medicare will pay the balance. Once you are discharged, if you remain out of the hospital for at least 60 or more consecutive days, and later that year, you re-enter the hospital as a new admittance, Medicare is going to define that admittance as a new benefit period. Thus, one would be responsible for paying that $1,484 deductible again. So it's possible for people to pay this deductible more than one time in a calendar year, and it's going to be contingent upon the frequency of hospital admittances you have and how much time or duration goes by in between those hospital admittances. If it is greater than 60 days between admits, one is going to be subject to this $1,484 deductible again. You can also see that if someone has an extended hospitalization stay between 61 and 90 days, you are responsible for the first $371 per day. Medicare will cover the balance. And if one requires hospitalization beyond 91 days, up to 150 days, you're going to be paying $742 per day. Medicare is going to cover the balance. Medicare does not cover expenses for hospitalization beyond 150 days. I would consider that more of an extended care type of stay, possibly a nursing home or assisted living or memory care. Medicare does not cover extended care stays. So one can see that there is a fairly significant out-of-pocket expense exposure that one has by enrolling in Medicare Parts A only. Another component of Part A is skilled nursing facility care. Following a minimum 3-day inpatient stay, Medicare is going to cover the first 20 days of skilled nursing care. If one requires this kind of care beyond 20 days, from 21 to 100 days, the individual is responsible for paying $185.50 per day. Medicare will cover the balance. Medicare will not cover skilled nursing care beyond 100 days. So again, one needs to plan as they develop their longevity health plan. How am I going to protect myself should I need a level of care that is beyond the scope of what Medicare will cover? Few other items on Part A: blood transfusions, home health care, as well as hospice is covered by Medicare. With home health care, this is clinical care. Things like speech therapy or physical therapy or infusion therapy. This is not personal or custodial type care. Medicare does not cover those kinds of expenses. And if someone has a life expectancy of 6 months or less as a prognosis from their physician, Medicare is going to cover the hospice related expenses. So let's look at our pie chart now, and we shaded in what Medicare Part A covers. In those various segments, you'll see some white next to that, and that is intended to represent the various deductibles or co-payments associated with what Medicare Part A covers and what it doesn't cover. We still have a lot of white on this pie chart, and we'll be talking more about how we fill in or find that protection for those other areas.
Okay, now we're going to review Part B benefits. And Part B benefits are going to be your medical benefits as well as your preventive care benefits. So right here, there's a listing of quite a few examples of what those are going to be in terms of the outpatient types of services. You're going to have your outpatient doctor services, short stay surgical services and those supplies, physical therapy, speech, any type of diagnostic testing that you may get in your provider's office or in another type of facility, your durable medical equipment, those types of things like, and also medications that you may receive that are not self-administered. So for example, certain types of cancer medications, certain types of immunosuppressive types of diseases, and there's a variety of conditions where people actually have to get certain therapies and certain types of medications that are going to be administered in a clinic or in an outpatient facility or their doctor's office. Those types of things are going to fall under Part B, as well as ambulance services. And again, these are just a few examples. So again, think from an outpatient perspective, those types of things are going to fall under your Part B. Now, Medicare does cover quite a degree of preventive benefits as well. Now, one of them is your Welcome to Medicare visit. This is a one-time review of your health condition. Your provider's going to do a history review with you, not just of your health, but that of your family. You're going to receive education and counseling about the different preventive services that are going to be appropriate and indicated for you, such as vaccines, screenings, things like that. Anything that's going to help from a preventive state of mind is going to be covered under your Part B preventive type of visit or services. Now, this is not a physical exam. And each and every year, you're going to be eligible for a wellness visit. Now, your wellness visit is going to be somewhat similar to the Welcome to Medicare visit, but you can have this every year, whereas the Welcome to Medicare visit, you want to make sure that you get that completed within the first year of your enrollment. The annual wellness visit, again, is somewhat similar, but it's an update of your personalized plan. You can have it every 12 months, and it is also not a physical exam, and it's not subject to any of the deductibles. So if your preventive benefits are not. Now, the one thing that we mentioned and that we think it's really important for people to keep in mind is on both of these visits, while they are considered preventive services, they do not cover a physical exam. And while they shouldn't be considered one, and it's also something that primarily is going to be decided by your physician if you should receive one or not. You want to keep in mind that those are not going to be covered exams that Medicare is going to pay for. The other types of things that I have listed here on the screen as examples are different types of screenings. And there is a numerous amounts of screenings that Medicare is going to cover. It's important that you pay attention to these timelines because that's when Medicare is going to cover them. So we like to encourage people to, as you explore your options, such as we've mentioned before, you want to keep preventive services in mind because there are supplemental carriers that are going to let this decision be between you and your provider. For example, you might have different type of cancer conditions in your family, a family history of a parent or a sibling, a variety of different health conditions that you have a family history of. Your provider may encourage you to have those screenings much more frequently than what is covered by Medicare. So again, there are Medicare supplement providers that are on the market now that will cover any preventive screening as well as the physicals. They're going to cover them in full based on what is recommended by your provider. So that's just something to keep in mind as you are doing your research in this area.
Getting back to Medicare Part B, Medicare Part B does have a deductible, and that is $203 per calendar year, unlike Part A where it's a benefit period deductible. Once one has met their deductible in Part B, Medicare is going to cover the majority of services at 80%. 20% is going to be your financial responsibility. And it's important to understand that there is no limit on that 20%. So whether one has a $1,000 medical bill or a $100,000 medical bill, with Part B by itself, you are responsible for that 20% co-insurance. There's some items that Medicare Parts A and B do not cover. Things like dental, vision, hearing, long-term care, which I described earlier, alternative medicine, such as acupuncture and so forth. There are things that Medicare will cover, and there are a number of things that Medicare does not cover. And we're not suggesting that they're good or bad medicine. It's just regulations stipulated by CMS only allow Medicare to cover certain things. And one needs to be aware that if they are receiving a level of care and some alternative methods, they need to seek protection programs that are going to offer, whether it be individual dental plans, individual vision plans. There are ways to fill in and provide that kind of financial protection. So as we go back to our chart, we're filling in both what's Medicare Parts A and B is covered and what is not covered. Where you see in some of the segments where there's white next to the blue and red, that is intended to represent the deductibles and co-insurance. There are programs available that we'll talk about to cover pharmacy benefits, dental benefits. When it comes to long-term care type of programs, those are separate and independent from Medicare. And so we try and help guide people to fill in as much of this longevity health plan chart as possible and within whatever financial resources or budget one has available to them. So let's look at Medicare Part C, also known as Medicare Advantage plans. These are where private insurance companies contract with our federal government to offer hospitalization, outpatient medical, and in some cases, prescription drug benefits. But these programs are set up like HMOs and PPOs, as Stacy had referenced earlier. And these networks can change from year to year, and the plan designs and out-of-pocket exposure can change, and they frequently do. So if one elects to access care through this path, be aware that it may require you to review how the plans are changing each year and compare what are your out-of-pocket exposure maximums. Also, if you elect to access care through Medicare Part C, you do not have the right to purchase a Medicare supplement. It is only available to those individuals who enroll in original Medicare Parts A and B. You will still pay your Part B premium even if you elect to enroll in Medicare Part C. So as an example, if you are at the $148.50 for your Part B premium, you're still going to have to pay this premium for your enrollment in Part C, and that'll take the place of Part B. The other thing that I would like to mention is with Medicare Part C plan, it's important to note how you wish to access care. If you want the flexibility to choose your own doctors and hospitals throughout the United States, well, then maybe Medicare Parts A and B is a better option. Or if you have a second home elsewhere or like to travel outside of your home region, one must come back to their home region to access care in Medicare Part C, unless it's an emergency situation.
Okay, so now some details on Part D. This is a prescription drug plan, and they are run and managed by independent insurance companies. These insurance companies have been vetted and approved by Medicare, so they are all CMS approved that offer these types of plans. So for example, in the state of Colorado, there are actually 27 different plans available to one who is enrolling in Part D. The costs and the premiums are going to vary across all of the different plans. Some of the carriers may have multiple plans available. That's because we look at somebody's, not just their preferred pharmacies, but what's the main thing is what medications are you on? So there are ways to run comparisons across these different companies to find those that are going to be the most cost-effective for you, given the area that you live in, what pharmacies are available to you. Do you choose to use private pharmacies, or they all have mail order, and so on. So there's a variety of different things that's looked at in order to help select the one that's most appropriate for you. Now, this is an area that Mike and I have a lot of experience in. We are more than happy to assist anyone in doing their Part D, whether they're clients of ours or not. We do this for neighbors, family, clients, families, and so on, because it's something that you really should look at every year. It's one of the few parts of all of these different plans and associated services with Medicare that you can change each and every year, and actually you're encouraged to do so. The insurance companies have a right, and they typically do. They will change these plans each and every year. So the deductible might change, the premium might change, what types of drugs are covered are potentially going to change, especially your brand name drugs and newer drugs that are coming onto the market. They're going to vary in their coverage across these different plans. So there is a period of time between October 15th and December 7th every year where you're going to want to have someone assist you, or you're welcome to do it on your own. But you're going to want to do a comparison and make sure that the plan that you are currently enrolled in is going to be the best option for you in the subsequent year. Because once you, if you do choose to change your plan, it's between October 15th and December 7th, and it will become effective the following January. If you don't make a change, you are automatically enrolled in the plan that you currently have. There are some exclusions to what these plans cover, and they're listed here. So again, it's primarily prescription drugs. So having gone through all of the different pieces and parts of Medicare, as good as Medicare is, it's probably very clear to you that it's certainly not going to pay all of your potential medical costs, nor was it ever intended to be full and complete coverage for individuals for any healthcare costs that they may incur through the rest of their lifetime. Healthcare costs tend to increase as people age. And that's because, let's face it, as we all get older, we're more likely to need some additional healthcare services, and the types of services that are going to be required tend to be much more expensive. So we've gone through a lot of information here today, and this slide is just to give you an overview of what your options are when you are enrolling in Medicare. You can choose to stay on Original Medicare, which is Medicare Parts A and B. You can pick a Part C plan, which Mike has gone over in great detail. These are your Medicare Advantage plans. And then another option is to retain your original Medicare Parts A and B and enroll in a Medicare supplement insurance plan. And these plans are true insurance. They're not just health plans, they're insurance, and they're designed to help provide that more comprehensive coverage than Medicare alone, without being faced with those high out-of-pocket costs that remain after Medicare has already paid its portion. And then if you do stay with Original Medicare, with or without a Medicare supplement, then you have the right to purchase a Part D plan that fits your needs. So having said all that, again, we hope you recognize that there are many, many different options that are going to meet the different needs of individuals, you as couples, and as families. So we encourage you to keep that in mind, and when you're doing your research and when you seek professionals to assist you in this area.
Stacy, let me mention one other thing. If you can go back to the prior slide.
Certainly.
You know, as I described what Medicare Parts A and B cover, what's not covered, you can see that there is a significant amount of out-of-pocket exposure costs associated with just Medicare Parts A and B. A little over 50% of healthcare costs for seniors are actually paid by Medicare. CMS has reported in a study last year that the average Medicare recipient age 65 and over has more than $18,620 in healthcare costs each year. Purposely, one of the things that we have not described or talked about during this Medicare 101 presentation is the Medicare supplement, also known as Medigap plans. These are programs offered by private insurance companies to help limit or mitigate one's out-of-pocket exposure costs associated with Medicare Parts A and B. Certainly the Medicare Part C plans also limit what one's exposure is to their out-of-pocket costs. And certainly if any individual wants to learn more about the different Medigap plans that are available in the market, the costs associated with those programs, we're certainly open to scheduling time and sharing more information on that. Finally,
I think we're going to turn it back to, I was going to say, I think we're turning it back to Kevin now.
Oh, okay. I was just going to mention real briefly, there's different situations available to people, and you can go it alone, or you can choose to work with a professional to help guide you through the choices that you have. And I thank you.
Again, thank you for joining us today, and we hope you have learned more about the Medicare process. For any questions specifically related to Medicare, please contact Mike and Stacy Gallagher. Their contact information is in the chat box. And for any comprehensive financial planning around retirement, insurance, estate planning, or other long-term financial plans, please contact me, Kevin Ward. My contact information is also in the chat box as well. Thank you, and let's see if we have any questions.
We do have a few here. Let's see here. The first one is, do you need to enroll when you turn 65 if you're covered by your spouse's company health plan?
The answer to that question is no. As long as you have credible group coverage, either as through your own employment or covered as a dependent, you may defer your enrollment in Medicare, and that's what I refer to as that special enrollment period. Once you lose access to that coverage through your spouse's employer plan, then you have up to 8 months to enroll in Medicare without being subject to a late enrollment penalty. And once you enroll in Medicare Part B, you have up to 6 months to elect to enroll in a Medicare supplement and still retain your guaranteed issue right.
And then we do have, we have two more, excuse me. Let's see here. We have, how can one lower your Part B premiums if your income 2 years ago was unusually high, such as a sale of a house with significant capital gain?
That's a great question. We're frequently asked that. You can appeal to Social Security and present the documents that this was a one-time occurrence and it is not reflective of what you are expecting to live on an ongoing basis. Typically, this will require at least a phone appointment with a representative from Social Security, and they'll be able to confirm which documentation they'll need from you to reconsider what your Part B premium is going to be. And so there is the opportunity to appeal this, but it's going to require some additional effort and pulling together some documents that reflect your position on the Part B premium.
All right, got a couple more. Sherry wants to know if you can go over Part G very briefly.
Part G as in George?
Yes.
Okay. I believe this individual is referring to the Medicare Supplement Plan G, which there is a Medicare Supplement Plan G. And the Supplement Plan G basically will cover all eligible expenses not covered in Medicare Parts A and B with one exception. It does not cover the $203 Part B deductible. One will pay a premium for Plan G. It's one of the most comprehensive supplement plans. I kind of use the analogy, you're driving the Cadillac as it relates to health insurance when one elects to enroll in Plan G.
I think it's also important to point out that sometimes people will hear that the different supplement plans are all going to be the same. So for example, G is going to be the same on any company that you purchase your Medicare supplement plans from. Now, while it's true that CMS has identified core components that every single Plan G must have contained in what the insurance company is offering, that is true. But companies are also allowed to provide what we call enhancements in the insurance policies. Then that's one of the things that you're going to find that is different across the different companies. So for example, the preventive screenings that I mentioned that some of your insurance companies are going to cover that in their Medicare supplements, not every insurance company is going to have those. So that's just an example. There are core components that will be the same, but you're going to want to compare them across the board in terms of what other types of enhancements that they have available to you.
All right, perfect. Thanks, guys. That is all the questions we have.
Okay, very good. Well, thank you, everyone.
Thank you.
Thank you.
Perfect. Thank you, everyone. Have a fabulous day.